Good afternoon. This is Dr. McDaniel. It's Sunday, May 20th, and I'm back on GYN Corner, Facebook Live, and it will also be on YouTube channel, GYN Corner. As the title suggested, or I guess it stated, I'm presenting information on the vaginal contraceptive ring. The brand is called NuvaRing. There is a generic for it, etogenestrol, but most people just get the brand, which is the NuvaRing. The NuvaRing is the second most popular contraceptive method. The first, of course, are birth control pills. I spoke the other week about birth control pills or oral contraceptives. There's a gajillion of them. They all do the same thing. They suppress ovulation, so no egg, no pregnancy. The ring does the same thing, suppresses ovulation, no egg, no pregnancy. However, with the ring, it's different than the pills. So both the ring and the pills have combined hormones, so estrogen or estradiol and progesterone. Those two combined in a constant suppressive state, they prevent ovulation. So same story, you don't ovulate, no egg, no pregnancy. However, the ring is considered to be local, it's not systemic, so a lot of the side effects that we use the pills for to help with different issues that people are having, we can't use the ring for. So a lot of people take the birth control pills to regulate certain premenstrual symptoms, breast tenderness, bloating, acne, appetite change, all of that. You can't use the ring for that. Now, certain pills will increase or exacerbate certain premenstrual symptoms for some women, and the good news is that the ring won't do that either, because it doesn't help with premenstrual symptoms, but it also won't add or exacerbate or cause any premenstrual symptoms. So the ring is nice because it really just works locally. It's specifically just for contraception. Now, certain pills you can take that will lighten and shorten the cycle significantly for some women. The ring doesn't do that. The ring will usually give, regardless of where that person starts with, it will usually induce 4 to 5 day menstrual cycles, light to moderate flow. The ring will decrease menstrual cramping because you don't ovulate, so you don't have the cyclical production of prostaglandins that causes cramping. So it will lighten and shorten the cramps, will decrease them significantly. It does not, even though it does suppress ovulation for whatever reason, scientifically we don't know why, it does not seem to lighten and shorten the cramps and minimize the cramps as well as most of the low-dose monophasic birth control pills do. So the ring will suppress the cramps a lot because it prevents ovulation, just doesn't do it as well as some of the pills will. It will lighten and shorten the cycles. Most women, as I said, it will get 3 to 5 days. Usually it's around 4, light, moderate flow. But with some of the pills, you can get 1 to 2 days or skipped cycles. So it's still not as good as the pills on that behalf. The good news and the bad news for some people is that it does not manipulate hormonal symptoms, so premenstrual symptoms. So it won't lighten, shorten a lot of the symptoms that people have. They may have 1 to 2 weeks of symptoms naturally. Some of the pills will give them maybe 1 to 2 days, and it won't lighten them as much, but it also won't induce certain symptoms that some women will have. So that's the advantage of it. Some women always have issues with certain pills. It doesn't matter what it is. And with the ring, they shouldn't have any of those issues. Now, of course, not everyone follows that bell-shaped curve, so some women will always complain that they have certain premenstrual symptoms or certain issues on the pills, and they still have it on the ring. Scientifically, that should not be the case, but of course, some people are going to be at the extremes of that bell-shaped curve, and they may or may not have issues that scientifically are not explained. The nicest advantage of the ring is that you don't have to take a pill every day. For the birth control pills, you have to take a pill every day at the same time every day. So within the same, ideally 15-minute time frame every single day, regardless of what's going on. If you don't take the pills every day at the same time, they're not guaranteed to work. That's how people get pregnant on the pills every month. The nice part about the ring is that you don't take a pill because it's a ring. So for the ring, you have to be comfortable sticking your fingers in the vagina, as I like to tell the patients. You have to be comfortable sticking your fingers in the vagina twice a month. First, to put the ring in, you just squish it up, stuff it up into the vagina until you don't feel it, just like tampons. And then you have to be comfortable sticking your fingers in the vagina again to hook it out. Everyone says the ring is easy to place, easy to remove. The catch is, some people tell me they get the heebie-jeebies putting their fingers in the vagina like that. Some people just don't like the concept that the ring is just sitting in there all the time. It's like wearing a tampon all the time, and they don't know if that's safe or if it's medically okay. Of course, it is safe. It's medically okay. It's just looks like a clearish, translucent, or cloudy colored ring. It's about that small. So it's about that small, a little bit smaller than my eyeglasses frame, and it's squishy. You can take the ring out for up to 3 hours at a time. You just have to remember to put it back in. It's one size fits most as usual, so it's not one size fits everyone. Some women cannot wear tampons. The tampons fall out or slip down when they cough, sneeze, etc. Same with the ring. So it's one size fits most. It depends on how good of pelvic muscle strength you have, pelvic floor. As I mentioned before, I live by design, I live right in front of New Jersey Transit. There's the train coming right there. Yay, New Jersey Transit. So I live by design, I live by the New Jersey Transit because when we moved from Manhattan to New Jersey, the key for me was to find a home that we liked that was walking distance to the train station, because rain, snow, sleet, hail, blah, blah, the postman's mantra. I had to be able to get on New Jersey Transit. So as long as the transit's running, I'm able to get in and out of the city. Our office is Midtown Manhattan. This train goes directly to Penn Station. No transfers. Knock on wood, it rarely ever gets crowded. It's not like the LIRR is always crowded. To Long Island. So this train, it's only once an hour. Usually I'm inside and not always outside, so you can't really hear it anyways. It's easy. Get on the train. I'll either read or go to sleep. Wake up at Penn Station. Perfect, exactly what we wanted, exactly what the doctor ordered, except when I'm out here talking, not so easy. All right, bye-bye NJT. And once it's gone, there's the parking lot. So I go right outside, backyard. We live in a cul-de-sac, so it's nice. And then New Jersey Transit. So it takes me 2 minutes to get to the train station. Actually, it's less than 2 minutes. It takes me about 30 seconds to get to the train station and to the platform. So it's pretty easy. Of course, I forgot what I was saying now. Yeah, so you do have to be comfortable sticking your fingers in the vagina twice a month. You can take the ring out for up to 3 hours at a time. Of course, you do have to put it back in within the 3 hours, or it doesn't work. Most women do tell me that they leave the ring in for intercourse, sexual activity, but you can take it out if you want. You can take it out. Some people will notice that they get like a weird cloudy discharge every blue moon. Someone will tell me that. You can take it out, rinse it off every day or a couple times a week in the shower tub, put it back in. That will eliminate that weird discharge that some people will notice. Most people don't notice it. Some people will comment on it. And the ring is 3 weeks in. The 4th week you take it out so that you get a cycle. So the 4th week, no hormones. That withdrawal of the hormones locally induces the menstrual cycle. You can do the extended cycle routine. So you can get a ring, put a fresh ring in every 3 weeks. So 3 weeks, replace immediately. 3 weeks, you can do 3 weeks, 3 weeks, 3 weeks. And you can allow yourself to skip cycles. So you could do every 3-month cycle or every 6-month cycle with a ring. A lot of women will do it just to skip their cycle for like a special event or something. But you can do it for extended times. The only caveat to that is that a lot of the insurance plans people have won't pay for the ring, same the way they won't pay for the pills. They won't pay for the rings to be provided to someone in advance like that. So you'd have to do potentially a mail-in system where you always get 3 months at a time, and then you may have to pay for one ring here or there to make up that extra time frame for the difference between doing it monthly versus doing it every 3 months. But can be done. It's perfectly safe, no issues, as long as you just keep track of the time frame. So sometimes I will get someone who says they forgot that the ring was in place until they start having weird bleeding, and then they remembered they had the ring in place, and it's been maybe 4 or 5 weeks. The ring is not supposed to be relied upon for contraception past the 3 weeks lifetime of that individual ring. So continuing with one ring past that is you're on your own reconnaissance. You're off the grid on that one. Some women will be able to eke out 4 weeks contraception, but that's not recommended. It's recommended to replace the ring every 3 weeks. So 3 weeks in, either out for a week, or 3 weeks in and then a fresh one in the following 3 weeks. Now, sometimes I like to tell the patient's wild stories, so I'm going to tell this wild story. I had a patient that I saw about 6 months ago. This was crazy. I had a patient I saw about 6 months ago. I had not seen her. I used to do everything. Major surgery, minor surgery, pregnancies, some of the high-risk pregnancies, deliveries. That's how I have the knowledge base to give my talks. But I cut out deliveries for lifestyle reasons. I cut out major surgeries for lifestyle. I cut out a lot of stuff for lifestyle reasons. As most people know, I have 4 kids. I now live in the suburbs, and just because everyone has to have a balance of life and work, the best balance for me was to cut everything out. I still keep up to date on things. I still give counseling and do consults on a lot of things, especially surgeries and especially pregnancies. I still see the first trimester pregnancies, but I'm not out in the fields doing everything now. It's just not sustainable for me, as they say. Not sustainable. So I had a patient I had seen for a couple of years, young woman. She got pregnant. I saw her the first trimester. And as I tell the patient, she graduated. Woo! We gave her cap and gown. She went to the OB doctor now because I'm not doing the delivery. So she had the baby, and nicely enough, a lot of the patients come back. It's convenient for them. Thankfully, they like me. It's convenient for them to come back after the baby. But I didn't see her right after the baby. So she had the baby. And then I saw her maybe when the baby was around almost about a year old. Maybe a little over a year old. Maybe 12 months, 14 months or something. And I had seen her maybe 3 months earlier for a problem, for like a yeast infection or something. For the yeast infections, I just put the speculum in, I do the cultures, give treatment, blah, blah. But for a comprehensive GYN annual, for the annual for GYN, I'll also do a bimanual exam where we put the hands on the belly, the hands in the vagina, or fingers in the vagina, and I feel for the uterus, ovaries, any adnexal masses, anything unusual on the pelvis. Now, American College of OB-GYN has actually recommended that we don't do that bimanual anymore unless someone has complaints of pain, because obviously, as I like to tell patients, everything in GYN is uncomfortable. So it's uncomfortable. Some people flip out. They're jumping all over the table because hands in the vagina, you press on their belly. This is a train going in the opposite direction. Woo! That one's going to New York. The first one was going further south, New Jersey. But of course, they're once an hour in both directions. So, there's that one. So, I had seen her a couple of months prior for an infection, but I hadn't done it bimanual because that's not necessary. You don't need to do that for a vaginal infection. And now for the annuals, American College of OB-GYN says you don't need to do bimanuals for the annuals either, but I've been doing this for almost 30 years. I'm used to doing bimanuals with the annual, so I do the bimanual exam for all annuals. Doesn't matter how young she is, doesn't matter how old she is, doesn't matter if she had an issue or not. I'm going to do bimanual because that's what I'm comfortable doing to make me feel like this lady had a complete exam. I did the bimanual and I said, wait a minute. I said, you didn't say you were on the ring. I said, you have a vaginal ring in here? I said, you said you weren't on any contraception. You have a vaginal ring? She goes, I don't have a ring. And I pulled out a ring. I go, then what is this? Instead of a clear, soft, pliable ring, it was brown, hard, barely could flex it. I said, what is this? I said, this is a ring. She goes, oh my God. She goes, oh my God. She goes, I saw you 3 months ago, wasn't there? I said, no, I saw you 3 months ago. I had the speculum in. You were here for a yeast infection. You didn't come in for an annual. I didn't do the second part of the exam. I said, this ring's been in here for a long time. I've never seen a brown, dried up, hard ring. I said, when did you put this ring in? You had to put it in after you had the baby because obviously it would have come out with the baby. She goes, I think I put it. Now, of course, when you say I think I put, that means you know you put it in, right? Like, how could you think you may have put a ring in? She knew she put a ring in. She goes, I think I put a ring in when I had some weird bleeding and I had a weird period, like when the baby was like maybe 2 months old. I said, okay, so then this ring's been, so you put the ring in. You forgot you had a ring in the vagina because people forget it. You don't feel, it's like a tampon. You put a tampon in, you're not constantly feeling you shouldn't feel a tampon at all if it's in the upper 2/3 of the vagina. Same with the ring. You're not going to feel the ring. It's in the upper 2/3 of the vagina. I said, you put this ring in at 2 months? I said, who told you to do that? She goes, well, I think I had a weird period and I put the ring in because I figured it would stop bleeding. She goes, I read on the internet. She goes, I read on the internet that the ring would stop bleeding if I put it in. I said, yes, anything with estrogen will stop bleeding if you put it in, but you didn't know why you had the weird bleeding. That was really inappropriate to do. I said, you should have come in to get it checked out or gone to your OB doctor if it was right after delivery to get it checked out. You don't just go on the internet, read a recommendation and put it in because all of those recommendations don't apply to everyone. That's a general recommendation under those circumstances. It's not a specific, tailored, customized recommendation for you. So she goes, yeah, I had some weird bleeding, but it stopped the bleeding. I said, yes, it has estrogen in it, so it stopped the bleeding. I said, so then that means you've had this ring in your vagina for about a year. Yes, she had a ring, vaginal ring in the vagina, straight for 1 year, of course, and never had any issues, of course. So the selling point for the ring, for the new ring, is she didn't feel it, it didn't come out, she never had any issues, her husband didn't have any issues, everybody was happy as a clam, that ring sitting in there. And it wasn't until I did the bimanual exam that I felt it. I pulled it out, hard brown, I mean literally brown, like this color brown ring, and the ring is clear to cloudy. It was completely dried up. It wasn't as hard as a rock, but it was pretty hard because it was old. It had been dried out. No infection, no issues for her. So it also rang home to me that even though the American College of OB-GYN and all of these public health announcements, as I've stated before, about the breast issues, these announcements are public health announcements. They're for like the masses. They're not for individuals. And a lot of times when they make announcements like that, they're making it for either money or for convenience. That bimanual announcement that it's not necessary to do bimanuals on every woman for her annual was because a lot of, sometimes I don't really like doing bimanuals because a lot of people flip out. It's uncomfortable. It's pressure. It's never painful unless you have a medical condition. It's just a lot of discomfort. You got fingers in the vagina and someone pressed on your belly. Nobody wants that. And as physicians, we don't like doing these exams. We do them because it's necessary for your health. And that just rang home to me that what if I had taken that recommendation by American College of OB-GYN not to do bimanuals, and God only knows how long this lady would have had that ring sitting in. And then even though ACOG says you don't need to do bimanuals on everyone, I would have looked like the fool because she saw me as a gynecologist and I never did a bimanual. No one would have said, oh, well, she didn't need a bimanual. It's not really recommended anymore. And she didn't complain of pain. They would have said, oh my God, she saw the gynecologist and the gynecologist never found it. Well, with the speculum, it's not going to find it because the blades of the speculum will cover the ring, which is why when she came in 3 months earlier, I didn't see the ring. I put the blades in for the speculum, did the cultures, that was it. It wasn't until because I'm old school, 30 years now, I'm old school, I did a bimanual because that's what I do to feel like this lady got a complete evaluation for GYN. I mean, we've whittled away so many things in medicine. Now we have internists doing pap smears. If the pap smear is abnormal, they can't manage it. They still send the patient to GYN. But we have internists doing pap smears. Everybody and their sister Sue is throwing a sonogram on somebody for half the time for nothing, just because they don't do bimanuals. But this wouldn't have been seen with the pap smear. It wouldn't have been seen with the sonogram. You had to actually be a gynecologist, put your fingers in the vagina, do the bimanual exam. So I guess take-home messages: the NuvaRings for most people aren't uncomfortable. They don't cause issues for them. They're pretty easy. They're easy to put in. They're easy to take out. And see your gynecologist for a full, complete exam. Make sure they do the bimanual at the end. If they're used to doing bimanuals, bimanual reveals a lot about a patient's health status pelvic-wise. So I went a little bit off tangent, but it was a little bit on tangent because it was with respect to the NuvaRing. Hope that's been helpful for people who have been interested or curious or didn't know that the ring was an available contraception for equally valuable for contraception as the pills. And I hope everyone enjoys the rest of their sunny Sunday. At least it's sunny here in the Northeast tri-state area. Be back tomorrow, Monday Morning Blues. This is Dr. McDaniel, GYN Corner, here on Facebook Live, and check out the YouTube channel. I know it's not looking great yet, but I'm slowly working on it. I'm getting my 11-year-old to slowly improve it bit by bit. It'll probably be over the course of the year or so. Have a good rest of the day, and thank you for joining me.